In Texas, access to health care often depends on where you live, and in rural parts of the state, getting care can be difficult. Challenges include fewer doctors and hospitals and a higher percentage of people without health insurance. But there's a new effort to get more resources to rural Texas. As Adam Schwager reports, it could lead to a $1 billion boost for health care.
Well, let's be clear, rural hospital is in trouble.
According to a recent survey, over half of Texas's rural hospitals are at risk of closing, with 21 in immediate risk.
A large portion of them have negative incomes, marginal incomes at best.
Terry Scoggin is the interim CEO at Torch, the Texas organization of rural and community hospitals.
Texas is far ahead.
On Monday, he testified at a public comment session as the agency vies for a piece of a $50 billion pie the federal government has set aside for rural health care as a part of the One Big Beautiful Bill.
These funds, if we get them, are yours. They belong to rural Texans, and we want to prioritize local control as much as possible.
Entering the hearing, the commission had read over 300 written comments and visited 5 regional sites to hear from locals. At the meeting, they heard from those across all areas of the healthcare spectrum.
And sometimes pharmacies kind of get overlooked. We're raising our hand to say, put us to work. We've been here, we're rooted, and we know our people.
The federal bill behind this money also made significant cuts to Medicaid.
You're going to see these cuts in your rural communities with food, with insurance and those things. Those are going to hurt.
Scoggin says getting this money to rural hospitals is imperative.
When it gets split, we expect somewhere between $1 to $2 billion to Texas. We want to make sure that that money goes directly to the rural hospitals, not to other institutions, not to other people to help rural hospitals, but get that money to the rural communities.
For State of Texas, I'm Adam Schwager.
The deadline for the state to file rural health transformation funds is in early November. The Centers for Medicare and Medicaid Services plans to announce decisions by the end of the year. Thank you again for joining us for State of Texas. I'm Josh Hinkle. We'll be back next week to bring you an in-depth look at Texas politics.